January is Cervical Cancer Awareness Month, and one big thing for all of you to be very aware of is the potential for us to beat this cancer completely. And we do mean completely, as in eradicate it.
I do see a lot of potential in cervical cancer where if we do partner with our patients, if we do educate them, if they understand what we know about cervical cancer, I think we can potentially eradicate this cancer in the next couple decades.
That's not something you hear regarding cancer often, but Dr. Golden Menderes from Yale Cancer Center and Smilo Cancer Hospital said it can be done with a two-pronged approach.
The two critical things that we have to popularize and educate our patients on to get to where we want to get are prevention, which is pap smears or HPV testing, and secondly, the HPV vaccination.
HPV, or human papillomavirus, is a precursor to cervical cancer. Control the virus and the cancer won't develop. Now, if you do get infected, and keep in mind, Dr. Menderes said 80% of all people will be by age 50, pap smears will play a huge role in stopping cancer from developing.
The fact that there are over 15 years of latency between HPV exposure to a patient developing precancer cells or cervical cancer, we do have so much time when we can intervene and eradicate the precancer cells.
But for younger people, the goal is to prevent infection in the first place. And that's where vaccines like Gardasil 9 come in.
9 means it has 9 different types of HPV kinds in it, including the highly oncogenic, meaning cancer-producing HPV types. And we do know that the efficacy is over 90% with Gardasil 9.
She said at this point the results have been unmistakable both worldwide and Connecticut. She said widespread use of pap smears has led to a 70% decline in deaths since the 1950s. And then even a recent study within the past 5 years of people in Connecticut found about a 20% drop in cervical cancer prevalence following about a 15 percentage point rise in the amount of people who were vaccinated. So that is some good news.